I want to ask you something that most doctors never ask their patients directly. When did you last think carefully about what your bladder is telling you? Not in a general way, specifically. The changes you have noticed but perhaps dismissed. The symptoms you assumed were simply part of getting older. The signals your body has been sending that you have been meaning to mention to your doctor, but have not gotten around to yet. Because here is what I have learned in all my years of caring for people over 60. The bladder is one of the most honest organs in the human body. It does not hide problems. It signals them, clearly, consistently, and often weeks or months before a serious condition develops. The tragedy is that most people ignore those signals. They assume what they are experiencing is normal aging. They feel embarrassed to bring it up, or they simply do not know that what they are noticing is actually a warning worth acting on. Today, I am going to change that. My name is Dr. Naira Harrison. I specialize in senior health and preventive wellness. And today, I am going to walk you through 7 specific bladder warning signs that adults over 60 should never dismiss. I will tell you exactly what each one means, what conditions it may be connected to, and when it requires prompt medical attention. Some of what I am going to share will surprise you, because several of these warning signs are things people experience for months, sometimes years, before anyone tells them it is worth investigating. Stay with me through all 7, because the 7th sign is the one I see most frequently dismissed as harmless, and it is the one that can indicate something genuinely serious if left unaddressed. Before we go further, drop a comment below and tell me which of these 7 signs you have personally experienced. I read every single comment, and your experience in this community helps me understand what topics matter most to you. Warning sign number 1, needing to urinate more frequently than usual, especially at night. Let me start with the one that is most commonly experienced and most commonly dismissed. If you are waking up 2, 3, or 4 times a night to urinate, and this is happening consistently, not just after an unusually large amount of fluid in the evening, I want you to hear me clearly. This is not simply what aging looks like. This is your body sending you a specific signal. The medical term for waking at night to urinate is nocturia, and while some increase in nighttime bathroom visits is normal as we age, significant nocturia, particularly when it is disrupting your sleep night after night, deserves investigation. Here is why this matters beyond the obvious inconvenience. Every time you get up in the middle of the night, you are navigating your home in the dark, often half asleep, often disoriented. Falls in older adults happen disproportionately during these nighttime bathroom trips. A wet floor, a loose rug, a moment of dizziness from standing too quickly. And the consequences can be devastating. But the falls are not even the most important reason to address frequent nighttime urination. Nocturia can be a signal of several conditions that deserve attention. An overactive bladder, where the bladder muscle contracts when it should not. Diabetes, where elevated blood sugar causes the kidneys to produce more urine. Heart conditions, where fluid that pools in the legs during the day is reabsorbed when you lie down and then needs to be expelled. Sleep apnea, which disrupts the hormones that regulate urine production overnight. And kidney function changes that affect how your body manages fluid through the night. I had a patient, a 73-year-old retired teacher named James, who had been waking 4 times a night for 2 years. He told me at every appointment, and at every appointment he added, "But I am sure it is just my age, Dr. Naira." I finally sat him down and said, "James, this is not your age. This is your body asking for help." After investigation, we found he had undiagnosed sleep apnea and mild heart failure, both of which were contributing to his nocturia, both of which were treatable. Within 3 months of appropriate treatment, he was sleeping through the night for the first time in years. Your bladder is not waking you up for no reason. If it is happening consistently, please bring it to your doctor. Do not wait for the right moment. The right moment is your next appointment. Now, warning sign number 2 is the one most people feel too embarrassed to mention, even to their own doctor. But it is also one of the most treatable conditions I see in my entire practice. Please stay with me because what I am about to tell you could genuinely change your daily life. Warning sign number 2. A sudden, intense urge to urinate that is difficult to control. You know this feeling. You are sitting comfortably, or you are out running an errand, or you are in the middle of a conversation, and suddenly, without much warning, you feel an overwhelming, urgent need to urinate that feels almost impossible to hold. This is not simply urgency in the ordinary sense. This is a sudden, intense, difficult to control sensation that may or may not result in reaching the bathroom in time. In the medical world, we call this urge urinary incontinence, and it is associated with a condition called overactive bladder, where the bladder muscle contracts involuntarily and unexpectedly, sending an urgent signal regardless of how full the bladder actually is. What I want you to understand is this: overactive bladder is not something you simply have to manage around. It is not just an inconvenience to be accommodated with certain clothing choices or carefully planned bathroom routes. It is a medical condition with effective treatments, and it is one of the most undertreated conditions in adults over 60, specifically because people feel too embarrassed to bring it up. I understand why. This is not the easiest thing to discuss. But I need you to know that in my practice, when a patient finally brings this to me, often after years of managing it silently, and we begin appropriate treatment, the change in their quality of life is extraordinary. The freedom to go somewhere without mapping every bathroom, the ability to sleep through the night, the confidence to engage in social activities without constant anxiety. You deserve that quality of life. Please do not let embarrassment keep you from a conversation that could genuinely change your daily experience. Urgency incontinence can also occasionally signal neurological conditions, pelvic floor dysfunction, or bladder irritation from infection or other causes. All of these are worth investigating. All of these have treatment options. If you're experiencing this, write it down before your next appointment and make it the first thing you mention, not an afterthought at the end of the visit. The first thing. Warning sign number 3 is one where I need you to put everything else aside and really hear me, because this is the one where waiting, even a few weeks, can make a significant difference to your outcome, and I have seen too many people wait too long. Warning sign number 3, blood in the urine. I want to be very direct and very clear about this one, because there is no amount of blood in the urine that is normal. None. Whether you can see it clearly, urine that appears pink, red, or brown, or whether it is detected only on a urine test your doctor orders, the presence of blood in the urine always deserves investigation, always, without exception. I know the temptation is to wait and see if it goes away. I know that seeing blood in the urine is frightening and that sometimes the response to fear is to look away and hope it resolves on its own. I understand that impulse, but I am asking you not to do that. Blood in the urine, a condition called hematuria, can be caused by a range of conditions, some very straightforward and easily treated, and some that require prompt attention. Urinary tract infections, kidney stones, inflammation of the bladder or kidneys, certain medications, and in some cases, particularly in adults over 60, it can be an early indicator of bladder cancer or kidney cancer, both of which have significantly better outcomes when detected early. I have sat with patients who saw blood in their urine, waited 3 months to mention it, and came to me with a condition that was substantially more advanced than it needed to be. I do not say this to frighten you. I say it because I genuinely care about catching things early when the options are broader and the outcomes are better. If you see blood in your urine, or if a urine test comes back showing blood, please do not wait. Contact your healthcare provider within days, not weeks. This one is not a wait and see situation. Warning sign number 4 is something most people have experienced at least once. But after 60, it carries a meaning that most people are completely unaware of, and the part that surprises almost everyone. It may not even feel the way you expect it to. Warning sign number 4, pain or burning during urination. Most people have experienced a urinary tract infection at some point in their lives and know the distinctive burning sensation it produces. But pain or burning during urination after 60 deserves particular attention for several reasons most people are not aware of. First, urinary tract infections in older adults do not always present the way they do in younger people. The classic burning, frequent urination, and lower abdominal discomfort may be present. But in older adults, a UTI can also present primarily as sudden confusion, increased falls, unusual fatigue, or simply a vague sense of feeling unwell, without the classic urinary symptoms being obvious at all. This means that UTIs in older adults are frequently missed or delayed in diagnosis, and an untreated UTI in an older adult can progress to a kidney infection or, in serious cases, to sepsis far more quickly than in a younger person. Second, pain or burning during urination can also be associated with conditions other than infection: interstitial cystitis, a chronic bladder condition; kidney stones passing through the urinary tract; inflammation from non-infectious causes. In men, prostate conditions can produce similar symptoms. If you are experiencing pain or burning with urination, do not manage it with extra fluids and wait it out for 2 weeks. Get a urine test quickly. The test is simple, the diagnosis is straightforward, and treatment when needed is effective. I want to pause here for a moment. Type yes in the comments right now if you have ever dismissed burning or discomfort during urination as something minor that would eventually go away on its own. I genuinely want to know, because the number of people who do this is far higher than most people realize, and your answer helps me understand what this community needs most. And if this is something that recurs, if you experience multiple urinary tract infections in a year, please have a specific conversation with your doctor about recurrence prevention and about whether there is an underlying reason your body is particularly susceptible. Now we come to warning sign number 5, and I want to be honest with you before we start. This is the sign that almost nobody brings to their doctor. In all my years of practice, I have had patients managing this completely silently for 5, 10, even 15 years. If that is you, I want you to hear what I am about to say very carefully. Warning sign number 5: leaking urine when you cough, sneeze, laugh, or exercise. I want to tell you about a patient of mine, a 68-year-old woman named Dorothy. She had been managing this symptom completely on her own for 11 years. 11 years. She wore protective pads every single day. She stopped going to her exercise class because she was afraid of leaking during certain movements. She turned down invitations to go out because she was worried about laughing too hard. When she finally mentioned it to me, almost as a whisper at the end of an appointment, as if she was ashamed, I looked at her and said, "Dorothy, why did you wait so long?" And she said, "I thought this was just what happens when you get older. It is not." Stress urinary incontinence, which is the medical term for leaking urine during activities that increase abdominal pressure like coughing, sneezing, laughing, or physical exertion, is not something you simply have to accept. It is not an inevitable consequence of aging, and it is one of the most treatable conditions I encounter in my practice. The underlying cause in most cases is weakness or damage to the pelvic floor muscles, the network of muscles and connective tissue that support the bladder, uterus, and bowel. After decades of gravity, possible pregnancies, hormonal changes, and reduced physical activity, these muscles can become significantly weaker, and the result is the leakage you may be experiencing. In men, stress incontinence can occur following prostate surgery or prostate conditions. Here's what I want you to know about treatment. Pelvic floor physiotherapy, specialized exercises designed to strengthen the muscles that support your bladder, has an extraordinary success rate for stress urinary incontinence. Many people see significant improvement within 6 to 8 weeks of consistent practice. This is not a complicated treatment. It does not require surgery. It does not require medication. It requires commitment to a daily exercise program program under the guidance of a pelvic floor physiotherapist. Dorothy came back to see me 8 weeks after starting pelvic floor physiotherapy. She walked in smiling. She told me she had gone back to her exercise class that week, that she had laughed at dinner with her family the night before without a second thought. She looked at me and said, "I lost 11 years to something that was fixable in 8 weeks. Please do not let that be your story." There are also other treatment options for cases that do not respond to pelvic floor exercises: medication, minimally invasive procedures, surgical options. Your doctor can walk you through what is most appropriate for your specific situation. But none of those options are available to you if you never bring it up. So please write it down, take it to your appointment. This is a quality of life issue that is absolutely worth addressing. Warning sign number 6 affects both men and women, but for very different reasons. And there is a specific question I want you to ask yourself right now as we go through it together. Warning sign number 6, feeling like your bladder never completely empties. Do you finish urinating but still feel like you need to go again almost immediately? Does it take a long time before urine starts flowing? Do you experience a weak or interrupted urine stream? These symptoms matter, and here is why. When the bladder does not empty completely, residual urine remains. That sitting fluid is warm, nutrient-rich, and becomes a breeding environment for bacteria, which significantly increases the risk of recurring urinary tract infections. Over time, chronic incomplete emptying can also place additional stress on the kidneys. In men, incomplete bladder emptying is frequently associated with an enlarged prostate, a very common condition after 60 that gradually compresses the urethra and reduces flow. This is one of the most common conditions I see in male patients over 60, and it is one that responds well to treatment when identified. In both men and women, incomplete emptying can also be related to weak bladder muscles that have lost some of their contractile strength over time, nerve-related conditions that affect bladder signaling, or a structural obstruction somewhere in the urinary tract. The way this is investigated is straightforward. A simple ultrasound after you urinate, called a post-void residual measurement, tells your doctor how much urine remains in your bladder. It is quick, non-invasive, and provides genuinely important information. If you recognize this symptom, the persistent sense that your bladder is not emptying fully, please name it specifically at your next appointment. Do not just say, "My bladder has been bothering me." Say, "I finished urinating, but I feel like I still need to go." The specificity helps your doctor understand exactly what to investigate. And now we reach warning sign number 7, the one I see dismissed most often, the one that seems the most harmless on the surface. But please stay with me, because this is the sign that when people finally mention it, most often leads to something important being found. Warning sign number 7, cloudy or strong-smelling urine that persists for several days. Let me be clear about what I am not talking about first. Temporary changes in urine color or odor are completely normal and almost always harmless. Asparagus produces a distinct odor. Certain vitamins turn urine a vivid yellow. Dehydration concentrates urine and makes it darker and stronger smelling. A single day of cloudiness after a high-protein meal is not concerning. What I am talking about is persistent cloudiness or persistent strong odor, lasting several days, that does not resolve with good hydration and has no obvious dietary explanation. Persistent cloudy urine can indicate the presence of bacteria, white blood cells, or protein in the urine, all of which signal that something deserves investigation. Urinary tract infection, kidney dysfunction, protein in the urine, which can be an early sign of kidney disease, dehydration that is more significant than you realize. Persistent, strong-smelling urine, particularly an ammonia-like or foul odor, can similarly signal infection or significant concentration from inadequate fluid intake. When these changes are accompanied by other symptoms, pain, burning, fever, lower back pain, fatigue, the urgency to seek evaluation increases significantly. Here is what I ask of my own patients. Do not ignore changes that persist. One day, fine, monitor it. 3 or 4 days with no clear explanation. Call your doctor. Do not wait for your next scheduled appointment if something has been consistently different for several days. A urine test is a simple, fast, inexpensive investigation that can either reassure you completely or catch something early when it is most treatable. Now, let me bring everything together with some practical habits that genuinely support bladder health after 60. Drink enough water throughout the day. I know this sounds simple, but many older adults quietly reduce their fluid intake specifically because they are trying to manage urinary symptoms, which actually makes most bladder conditions worse rather than better. Concentrated urine is more irritating to the bladder lining. Adequate hydration is genuinely protective. Do not hold your urine for long periods. When your bladder signals that it needs to empty, respond within a reasonable time. Consistently holding urine for extended periods stretches the bladder and can contribute to bladder muscle changes over time. Limit caffeine and alcohol if they worsen your symptoms. Both are bladder irritants for many people. Coffee, tea, cola, and alcohol can all increase urgency and frequency in people who are sensitive to them. This does not mean you must eliminate them entirely, but if you notice a consistent connection between consuming them and worsening symptoms, reducing them is worth trying. Stay physically active and maintain a healthy weight. Physical activity supports circulation, nerve function, and overall metabolic health, all of which affect bladder function, and excess weight places additional pressure on the bladder and pelvic floor. If you have diabetes or high blood pressure, work actively with your healthcare provider to keep those conditions well managed. Both have direct effects on kidney and bladder function, and both significantly increase the risk of urinary tract infections and other bladder conditions when poorly controlled. Before I close, I need to tell you clearly when to seek immediate medical attention, not at your next appointment, not sometime this week, but today. Please seek urgent medical care if you notice blood in your urine, particularly if it is accompanied by pain or clots. If you develop a fever along with painful urination or urinary symptoms, if you experience severe pain in your back, side, or lower abdomen alongside urinary changes, if you are completely unable to urinate despite feeling the need, or if you or someone you care for suddenly becomes confused, very weak, or develops a high fever alongside urinary symptoms, this combination can indicate a serious infection that requires immediate treatment. These situations are not ones to monitor from home. They require prompt evaluation. Here's what I want you to carry from this conversation today. Your bladder is communicating with you. It has been communicating with you. The question is whether you have been listening and whether you have been willing to pass those messages along to your doctor. None of the 7 warning signs I described today are things you simply have to accept as part of getting older. Every one of them has a cause, every one of them can be investigated, and most of them have effective treatments that can meaningfully improve your daily life. You would not ignore a warning light on your car's dashboard for months and hope it resolves on its own. Please do not do the same with your body. If this video gave you something valuable today, if there is a symptom you recognized, a conversation you now know you need to have, a piece of information that changes how you will approach your next appointment, please subscribe. I create content like this every week, designed specifically for the health realities of life after 60. Practical, honest, and evidence-based. And share this with someone you love who might need to hear it. The person who has been mentioning bladder symptoms but dismissing them. The person who feels embarrassed to bring this up with their doctor. This video might be the thing that helps them finally have that conversation. Tell me in the comments, which of these 7 warning signs surprised you most? And which one have you been experiencing but not yet mentioned to your doctor? I read every single comment. And your honesty in this community genuinely helps others feel less alone. Take good care of yourselves. Your body is always talking. I hope today helps you listen a little more carefully. I am Dr. Naira Harrison, and I will see you in the next one.